and other clinicians that work with this intervention, specifically with these populations, they all say you can't unsee what you've seen. And so it makes you very curious about what exactly is going on here.
Licensed mental health counselor and ketogenic therapy expert Nicole Laurent is launching her own study to look at the qualitative experiences of people who have recovered from mental disorders using ketogenic therapy. Let's hear from Nicole the details of the study and what she thinks it's going to contribute to the field of metabolic psychiatry and ketogenic therapy. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Well, Nicole Laurent, welcome back to Metabolic Mind. It's so great to be able to chat with you again.
Thank you. Thanks for having me.
Yeah, I opened up social media the other day and I saw this announcement from you that you're starting the study, and I thought, wow, that's so cool. We got to hear more about it. We got to tell everybody more about it. So give us the basics. What is the study that you are starting? And then we can get into some of the details after that.
Yeah, so I'm looking for participants for a study on ketogenic diets and mental illness recovery. So I'm going to be looking at the experiences of people who have self-identified as recovered or in the process of recovering from mental illness using a ketogenic diet. And I'm also going to gather observations from family members. So it's semi-structured interviews. I'll have the interviews with the participants. And then if they have family members who they would like to give me contact information for that I can talk to talk about what they observed in the recovery process. That's basically the people that I'm looking for. And my goal is to understand better how ketogenic diets contribute to mental health recovery, doing a qualitative retrospective analysis. So I'm looking at people's past events recovering from mental illness with the ketogenic diet.
Yeah, now, and how would you define, or how do you want individuals to define recovery in order for them to decide if they're candidates for this study or not?
Yeah, so a lot of what goes on in recovery is very personal and has a lot of really kind of personal definitions about what that means for them. So if someone is recovered or recovering, and they feel like the ketogenic diet is playing a really significant role in that, or has played a significant role in that, that's really the main definition. But this study kind of has some pre-qualification criteria to add to that definition that they have of their recovery. So I'm looking for participants who have, at some point in their treatment, a baseline mood assessment score from some kind of standardized instrument. So there's all kinds of them. There's the PHQ-9, the GAD-7, the DAS. There's all these different mood assessments that different practitioners give when they are evaluating mental health improvements or trying to make decisions about treatments. And so it's very likely that someone who has had a diagnosis and used the ketogenic diet at some point in their treatment process has taken some of those assessments, and either a therapist has them or a psychiatrist has them or a regular general practitioner has them. And so I'm looking for a baseline of where they were, and then some kind of follow-up assessment that has occurred that showed an improvement of 50% or more in total scores on that assessment. So just in general, I'm looking for people who have had some kind of quantitative type of assessment to enter into the study. And that just brings a little bit more, hopefully a little bit more validity to the findings.
Yeah, that makes sense, that there does need to be some sort of qualification. But it sounds like that's really the objective part of the study. And the rest of the study is fairly subjective, which, if you're an ivory tower researcher, you can say you need data to make a study worthwhile, but not necessarily. There are different types of studies, and you're going to learn different things from different studies. So I think there's clearly a role for all sorts of types. So how do you see this as being more of a subjective study, sort of contributing to what we know about the field and helping out from a research standpoint?
Right. So the difference between quantitative data and qualitative data, those types of analysis, they both have data. Often the data that we're looking at in quantitative tends to be more numbers, right? But these experiences that people are having on ketogenic diets as a recovery, as a treatment, those, I mean, we see the numbers improve. We've seen lots of numbers improve on standardized assessments in these pilot studies and these clinical trials, but they don't quite capture what this looks like for people and what this means and what was involved in them getting to where they are and how it's changed their life and what doors it's opened, and all of the different things that are part of recovering from mental illness in general. And I'm very curious about if that's the case with a ketogenic diet as well, and if possibly something even more is kind of happening with that. So it's still data driven. A qualitative analysis is using data, but the data is what people are saying and what they're reporting as their experience. And then we look at that in such a way that we see if there's emerging themes. Like if I have 50 people, a mixture of both of family members who have watched someone recover from a serious mental illness or any mental illness, and they've seen that process and what that looked like and what that meant for them as the family member and what that meant for them watching the person recover, and then also the participants themselves. And I have all this converging information where many people are saying, this is what this has meant to me, this is the experience I've had, this is how my brains works better, this is how my emotions are different. That's data. That's data. It's just not a number.
Yeah, and I love the fact that you're including family members and people in the inner circle, because it really highlights how mental disorders don't just affect the individual but can affect all those around them, and is so impactful. And so when they recover, if they're able to put that into remission and recover and improve so much, again, it doesn't just affect their lives, it affects their loved ones' lives as well. So I think that's such an important point. And it's such a great point that it's still data. It's just data that they report, and data that you can't really capture otherwise, right? Like a GAD-7, a PHQ-9, a HAM-D score, they're not going to necessarily tell you that now all of a sudden they're functioning independently where they didn't before, and they can have a job now, and they can have relationships now, and they have a better relationship with their friends now. Like those are things that don't necessarily get captured, but when someone explains, like totally changes the way you see things. So I assume that's a big part of your motivation for doing this. Is that right?
Yes. So you and other clinicians that work with this intervention specifically with these populations, they all say you can't unsee what you've seen. And so it makes you very curious about what exactly is going on here. Um, it, in terms of, the level of functioning that we see in people who are self-describing as recovered or in the process of recovering. I'm doing much better, I'm on my way to, not needing to do this anymore, or maybe they're titrating medications and their psychiatrist is agreeing with them that they are on the road to recovery. So it just, what you see, it's really, I don't think I have words for what I'm watching. I mean, I can say this person went from having a severe mental illness and having a very small life that was around coping as opposed to thriving, and now suddenly, there's things going on, like people are entering into relationships, people are being social, and not just social more, like they're thriving. What is going on here? So I think that I just really I'm really interested in collecting data to try to figure that out. There's something really kind of amazing and I think potentially special. And it was funny, I had a comment that said, well, you're not looking at the people with the ketogenic diet didn't work for them. And I pointed out that I'm very, that's not the population that I'm looking at. That's not the phenomena I'm actually studying with this. And that doesn't mean that that data doesn't matter for those people, and we need to figure out what was going on there. But I'm really curious about what are the mechanisms, not mechanisms, but what are the things people are reporting that are part of their recovery that are consistent in the people that are getting these really wonderful results. And so that's the population I'm interested in at this time.
Yeah, and that actually makes a lot of sense. And it can even then apply to the people who aren't getting the results, because they could maybe learn from some of the techniques and tips that those who are getting results were using. So it certainly can apply, but that brings up a good point, right? Not everybody responds the same way. And if you highlight the people who benefited, it's not highlighting the people who didn't. And those people do exist. And that's, randomized controlled trials are looking at that. We have lots of studies going on looking at mechanisms, trying to figure out why does it work for some and not for others. And these are really important details. Doesn't mean every single study has to look at that to be a valid study. So I really like how you explain that. That makes a lot of sense. And you're seeing these dramatic recoveries in your practice. I mean, you see people one-on-one, you see people in groups, you've helped a lot of people and seen these recoveries. So now you're branching out to try and get people outside of your practice to get some of those, the same feedback. So can people start enrolling now, and where do they go to find out if they are a candidate to enroll?
Yeah. So they would just go to mentalhealthketo.com. You'll see a link that says ketogenic diet, mental illness recovery study recruitment page. And it's right on the menu, so you can find it, and it'll tell you all about it. So some of the eligibility criteria specifically for what I'm looking for are for adults 18 years or older, or adolescents ages 14 to 17 with signed parental consent. They must be using or have used a ketogenic diet as part of treatment for their mental illness. They must have some prior baseline and follow-up scores showing improvement, like we talked about. And they must be stable in their use of the ketogenic diet and not currently receiving regular consultation from a dietary professional. So if they're still fine-tuning it and trying to figure it out, then that's not necessarily a good candidate for this study, but it might necessarily be for another one. Someone else needs to do some of these. These are really interesting for people. Self-reported confirmation of ketone levels at some point during their ketogenic diet treatment. So this is the one diet where we can actually have some kind of biomarker that shows that they have been doing the diet correctly or managed to do the diet correctly. And so I felt very strongly that needed to be part of the eligibility criteria. And that's just self-reported. And then currently self-identify as recovered or recovering from a mental illness that's actually categorized in the DSM-5. So it has to be one that is acknowledged in the DSM-5. Nowadays, there's a lot of people creating diagnoses names from symptoms, or things that they think should be diagnoses under the DSM-5 that have not actually been validated. So I'm looking for people who have something that we can find in the DSM that's considered a mental illness, and not necessarily in the section of the neurological disorders. And so that's kind of what I'm looking for. And then on the website, if you scroll down, there is a secure web form in which you can upload those mood assessments and give your pre-eligibility data. And then I'll contact you and we'll go from there.
Wow. Oh, fantastic. Very ambitious for you to start this study. And I think it'll really help because, one, it helps researchers see the qualitative impact of the research they're doing. Clinicians better understand the impact you can have on patients' lives, and individuals to realize, like, maybe my treatment isn't getting me where I want to be. Look at the improvements these others have. It can really impact all three levels, I guess you can say, of people involved in this type of care, wanting to get better and help others get better. So I'm really encouraged that you're doing this, and I can't wait to see the results. And thank you for being so ambitious to start it. So everybody, please check out the website, see if you qualify, and let's get you these subjects to get the study going. So thanks for joining me to tell everybody about it.
Yeah, thank you so much.